Hello everyone, I'm Dr. Amr Al-Khair, and today we're going to talk about two of the most common cancers for both females and males. Now I should state that based on my time spent in the oncology department, most of the patients I have seen are either diagnosed with lung cancer and in colorectal cancer. We're going to talk about the risk factors and the prodrome symptoms, which are the first symptoms that anyone might see, because we all know that the earlier you can diagnose a cancer, the better the outcomes are. Before we get into it, there is one point we need to establish, which is the non-specific general symptoms that all cancers have in common. They are night sweats, weight loss, disturbed sleeping, chills, fever, malaise. All of these symptoms, they're the non-specific symptoms. They could be pointing toward the cancer. Of course, they could be pointing towards something that's not so serious, and it's mostly like this, hopefully. But when we are facing these symptoms, we don't want to ignore it and say it's probably stress or hormonal changes or anything like this. No, we want to get ourselves checked. Now let's talk about lung cancer. What are the risk factors for lung cancer? Of course, smoking, we all know it's responsible for at least 80% of lung cancers, excluding adenocarcinoma, passive smoking as well, air pollution, occupational and environmental exposure to radon or asbestos. These are cancerous fumes, as well as any pulmonary diseases, like let's say scarring, fibrosis, a chronic infection. All of these are considered to be contributing factors or risk factors for lung cancers. We can clearly say that lung cancer doesn't give that clear symptoms until the late stages, which affect negatively on the outcome. But if you have any of those previous risk factors, it would be better to get yourself into a routine checkup program along with your physician. Now, what are the symptoms that someone with lung cancer might suffer from? Let's start with coughing. Coughing, any cough that is going chronic and that's not resolving on its own, needs to be investigated, especially for smokers. Smokers, they know their coughing habit. They usually cough early in the morning. And in case they have frequency in their coughing, or in the severity of their coughing, or even in the amount of sputum that they are producing, they need to have to investigate that. They shouldn't just ignore it. Second, progressive shortness of breath. This is typically for someone who's never had shortness of breath before and is not under any stress. Wheezing. What is wheezing? Wheezing is this whistling sound you make when you exhale. Coughing blood. Now, coughing blood is actually a bad symptom and a red flag that we need to investigate, and we hope that the patient might visit us before he reaches that point. Chest pain, or let's say discomfort in the chest. Finally, any repeated chest infections in the same area of the lung, in the same lobe, especially if the patient is above 50, must be investigated. And now let's discuss the colorectal cancer. What are the risk factors for it? They can be categorized into non-modifiable and modifiable risk factors. The modifiable risk factors are the thing that we have the power to change. It's our diet. Any diet that is high in carbohydrates and low in fibers. Smoking, alcohol intake, processed meat, obesity, all of these are connected directly to the colorectal cancer. As for the non-modifiable risk factors, they are the age, anyone who's over 40 years old, sex, especially males, family history, anyone with a positive family history for colorectal cancer has a percentage of 25% more than average people to get the cancer. There are some hereditary syndromes, like let's say FAP, any polyp, any adenomatosis, and all of these, they could be all contributing factors to the cancer itself. And these are things that we can't really control. And now the symptoms. What are the symptoms for colorectal cancer? It will start off with any change in the bowel habit that we might have, whether it was diarrhea, whether it was constipation, whether it was change in the consistency of the stool itself, whether it's changed in the shape of the stool. Mostly what we see is something we call pencil-shaped stool, which is a decrease in the diameter of the stool itself. This happens because the cancer itself is growing toward the lumen of the intestines. Therefore, the shape of the stool would be smaller in the diameter, shaped as a pencil. Okay, second symptom, which is bleeding. Mostly if we see red, fresh blood on the toilet paper or in the toilet itself, it is mostly not something to worry about, but at the same time, any dark stool calls for further investigation. I should point out towards something very important, which is iron deficiency anemia in any man over 50 years old or any female that's post-menopause should be investigated for colorectal cancer. To put it bluntly, anyone with risk factors and bleeding, rectal bleeding especially, even with a history of hemorrhoid or diverticular disease, should be investigated for colorectal cancer. Other symptoms that people might suffer from, which is abdominal discomfort, whether it was pain or bloating. People might feel that they're not emptying their bowels when they go to the toilet, or feeling of pressure or something's pulling them down. Now that we have talked about the two most common cancers for both females and males, I hope you liked this video. I hope I helped you in anything. Please, if I did, share it in your stories so everyone can see it, and stay safe.